Charlotte Frankie. I'm going to be demonstrating how a charge nurse probably handles contacting the family when their patient falls. First, my step is to make sure that this patient is in stable and safe condition. Right now, he is presenting in that. I have noted the whole situation, what chronologically what order what happened. I have checked the bump on his head that make sure it's safe. He's presenting no signs of concussion. I'm gonna go over to my desk where my computer is in my office here, and I'm gonna chart this. So here I'm just gonna chart what's happening. Okay, perfect. Now I'm gonna talk to my fellow health professional, which is a CNA who's on scene helping our patient Grant get transferred from his bed to his walker. So what happened in this situation?
He fell up going to his walker and bumped his head.
Okay, that's great. That's what I had down. I just want to make sure that there was no signs of concussion.
Nope.
Once you dig him on his walker, he was walking normally?
Yep.
Was he speaking normally?
Yep.
That's perfect. You put him on no pain medication,
nope.
correct? So any medication he has is always on medication,
yep.
right? Perfect. I'm gonna go to my desk and I'm just gonna make sure that all my details that I'm charting, right? They're concise, they're detailed, and they're perfect for understanding it. Okay, great. I had that already. Next, I am gonna be focusing now on making sure that my information is on hand for when I'm calling my patients, emergency contact, that they are not worried, and I can do it very clear, concise, and fast, and patiently, of course. I'm gonna make sure that my emergency contact is correct, which is Grant's daughter. Perfect. Her number is correct. I'm not calling the wrong patient's family. I'm gonna call and introduce myself. Hello, this is the charge nurse here at Russell Hills Assisted Living Facility. My name is Charlotte Frankie. Am I speaking to Ava? I'm gonna now explain the situation on the phone call. Hi, Ava. So Grant happened to fall out of his bed when we were transferring him to his walker. He didn't. Once we could get him back up on his feet, he was perfectly fine. He was standing. He was walking normally. He did not present any signs of concussion. His vitals and his heart rate were fine, and he really had no injuries except one small bump on his head that just really could be through the hit of the shock. Do you have any questions revolving this? Yes, he will not be taken to the hospital right now unless anything changes in his condition. We are not planning on sending him to the hospital. Perfect. So I'm gonna create a plan of use to try to make sure that this doesn't happen. I did have an idea of maybe transporting him to the wheelchair first to give him a minute to slow it down a little bit, and then from the wheelchair going up to the walker. We could also add some railing on his bed. Either one. You'd rather add railing to his bed? Okay, and we are gonna slow it down for sure. Just since we did get one fall, we don't want another. Okay, great. Thank you so much. Do you have any other questions, Ava? Yeah. No. Okay. Yes, you can come in. Actually, just make sure your documentation's all filled out, right? Yeah. Then you can come in. We're gonna make sure that he is perfectly fine, which he is. We're just gonna ensure that, and we'd love to see you here. So now that I have my plan created, I'm gonna show this to my CNA and other healthcare professionals. Is this plan good?
Yep.
Good. You agree with maybe slowing it down a little bit?
Yep.
And wake him up? Perfect. Now, as I said on the phone call, I'm gonna make sure that my patient is fine again. Right now, he's not presenting any changes. We're gonna continue to check up on him, and then we're gonna hope that his family members come visit him. Thank you.